Hello and welcome to ENT Nursing Review. These are some of the questions that were tested between the period September to December 2024. The first question was, the immediate care for a patient suffering from epistaxis include keeping the patient quiet. We have four options. And out of the four options, the correct one was Nurse A. You keep the patient in a sitting position while applying pressure by pinching the nose for about 10 to 15 minutes. This is very important because it's going to help control bleeding while avoiding aspiration. Which assessment finding puts a client at increased risk for epistaxis? Correct. The best option is cocaine use, and this cocaine use normally causes mucosal dryness and vasoconstriction, and this increases the risk of nose bleeding. The nurse is evaluating the effectiveness of a teaching plan for a client recovering from an upper respiratory tract infection. Which is the expected outcome for the plan? The client should experience less nasal congestion and discharge. Nasal obstruction reduction, right, is the best option. The nurse is aware that the best position for a client with impaired gas exchange is what? Impaired gaseous exchange. You do the high Fowler's. Tripod position. This position promotes maximum lung expansion, right? Remember, side lying will not optimize oxygenation, while Sim's position is not effective for gaseous exchange. Semi-Fowler's position is suboptimal when you compare it with the high Fowler's position. How should the nurse assess the posterior nasal bleeding in a client who has just had nasal surgery? Right, making it posterior, you have to use a pen light to inspect the back of the pharynx for the bleeding. Remember, posterior bleeding is best visualized using the pen light. When the nurse is monitoring a patient for CSF, you should observe for the halo sign. This is normally a clear ring around bloody fluid or gauze to indicate CSF leakage. Tynometry is a method used to assess the eustachian tube malfunction. Structures in the middle ear include the round window and the eustachian tube. A client's symptoms indicative of a complication associated with acute otitis media. Right? Acute otitis media complication will have abrupt relief of pain because this can indicate perforation, and this is a complication. The specific antidote that is used that the nurse should administer to a patient reported to have received an overdose of warfarin is vitamin K. Remember, protamine sulfate is for heparin. Atropine sulfate has no role, but it can be used when you have a cholinergic crisis. Now, naloxone is for the opioid overdose. The nurse is caring for an old adult client who has experienced sensory neural hearing loss. The nurse anticipates that the client will exhibit which symptom? Sensory neural hearing loss are going to present with difficult in hearing high-pitched sounds, right? Because sensory neural affects this. Following nasal surgery, the client has packing in the nose. What should the nurse include in the care plan? With the packing, you have to perform frequent mouth care because mouth care reduces dryness when nasal packing prevents breathing through the nose. The nurse is planning dietary needs with a client who is in early post-operative period after nasal surgery. What should the nurse tell the client? The client has to increase fluid intake because this is going to prevent dryness and also promote healing. The nurse is reviewing the record of a client with a disorder involving the inner ear. Which findings should the nurse most likely note as an an assessment finding in this client. Tinnitus, because this is the hallmark sign of the ear infections, inner ear infections. The nurse is performing an otoscopic examination on a client with a suspected diagnosis of mastocytitis. Which finding should the nurse expect to note if the disorder was present? Mastocytitis. We have a dull red tympanic membrane indicating inflammation, which is typical on mastocytitis. The nurse is giving preoperative instructions to a client who will be undergoing rhinoplasty. What should the nurse tell the client? They do not need to take aspirin-containing medication for at least 2 weeks before surgery because aspirin increases bleeding risk. A client is to have hypophosphatemia to minimize the risk of postoperative respiratory complication. The nurse should instruct the client to perform which action? For hypophosphatemia, you have to take deep breaths because deep breathing prevents respiratory complications, right? Like which one? Atelectasis. The classification of ear problems include mastocytitis, chronic spastic otitis media, foreign body in the ear, external ear infection. The priority nursing diagnosis for a patient admitted with an acute episode of Marian disease. Marian's disease, you have the risk for injury related to vertigo, right? This is the priority. Now, for question 20, you need to indicate whether the following statements are true or false, right? So, otosclerosis is a conductive hearing disorder. Cerumen impaction is managed by irrigation, softening, and then antibiotics. All these statements are true. Following massive blood transfusion, the likely electrolyte imbalance the nurse should anticipate should include, right? We have hypocalcemia and hyperkalemia. Remember, hypocalcemia, when you look at citrate in the blood products, most blood products are normally anti-coagulated with citrate, which binds the calcium in recipient's blood, and this will lead to transient hypocalcemia. This effect is more pronounced with large volume or rapid transfusions. Hyperkalemia, as you know, we have stored red blood cells. They can leak. They can leak potassium over time. So during massive transfusion, potassium is introduced into the recipient's bloodstream, potentially causing hyperkalemia. The appropriate nursing intervention for a patient diagnosed with CIDH production is CIDH. You would need to administer hypertonic IV fluids. The patient is suffering from sinusitis affecting the ethmoid bone, will feel pain in which area? This is normally between and behind the eyes. The ethmoid sinuses are located between the eyes and near the nasal bridge. The client reports that the nasal packing is uncomfortable and asks when it will be removed. The nurse should tell the client that nasal packing is usually removed between the 24 to 48 hours after surgery. This time frame allows adequate hemostasis and initial healing. However, removal may vary depending on the surgeon's protocol. The most common organism associated with tonsillitis and adenitis is group A beta hemolytic streptococcus. Remember, as a nurse, you have to recognize symptoms of bacterial tonsillitis such as fever, sore throat, and swollen tonsils with exudates. You need to be aware of the need for throat culture or rapid antigen detection test to confirm this group A beta hemolytic streptococcus bacteria. Then educate the patient on completing the full course of antibiotics to prevent such complications. Angioedema is a risk factor that leads to laryngeal obstruction and is usually caused by use of angiotensin converting enzyme inhibitors, especially the drug lisinopril. Angioedema is simply the swelling of the deeper layers of the skin, often caused by an allergic reaction or medication. A common cause is the use of the ACE inhibitors, which can trigger angioedema as a side effect. This swelling can affect the face, the tongue, the throat, and potentially leading to laryngeal obstruction and life-threatening airway or compromise. Other options, such as the foreign body or heavy alcohol use, might contribute to airway issues, but they are not typical causes of angioedema. Mechanical vibrations are transformed into neural activity so that sound can be differentiated by the organ of Corti. Remember, the organ of Corti is located within the cochlea of the ear. It is the sensory organ responsible for converting mechanical vibration caused by sound waves into neural signals. It contains hair cells that detect sound vibrations and transduce them into electrical signals, which are then sent to the brain via the auditory nerve. Following a tonsillectomy, a female returns to the medical surgical unit. The client is lethargic and reports having a sore throat. Which position will be the most therapeutic for this client? Sore throat, you do side lying so that at least this will enable some secretions. This will promote drainage of oral secretions, reducing the risk of aspiration and airway obstruction due to blood or mucus. It also facilitates breathing and prevents complication. The muscle that allows an individual to raise his eyebrow is called the occipitofrontalis. Remember, this muscle is also known as frontalis muscle. That is the frontal portion of the occipitofrontalis and is responsible for raising the eyebrows and wrinkling the forehead. It's part of the muscles of the facial expression and is innervated by the facial nerve, cranial number 7. A hearing loss that is a manifestation of emotional disturbance is referred to as the functional hearing loss, right? Hearing loss that does not have a physical cause and is often associated with physiological and emotional disturbance. It also sometimes called psychogenic hearing loss or non-organic hearing loss. Individuals with functional hearing loss may may appear to hear impairment, to have hearing impairment, but diagnostic tests often reveal normal auditory function. What test measures hearing acuity at various sound frequencies? We have audiometry, which is a test used to measure hearing acuity at various sound frequencies. It evaluates the ability to hear sound waves at different pitches and volumes. This test is typically performed using an audiometer, and results are then plotted on an audiogram, which provides a detailed picture of individuals' hearing capabilities. When approaching a deaf client, what should the nurse do? The nurse needs to needs to get the client's attention, right? When approaching the client, you need to get the client's attention in a respectful and non-startling manner. This can be achieved by gently tapping their shoulder, waving a hand in their field of vision, or ensuring that they can see you before speaking. This approach ensures effective communications and avoid startling the client. Patient T, who is due for tinoplasty, asks the nurse what the surgical procedure involves. The nurse should begin the conversation by assessing the client's understanding of what the doctor has explained. A positive Rhine test is seen in presbycubitis, right? The Rhine test is a tuning fork test used to compare air conduction vis-a-vis the bone conduction. So a positive Rhine test means that the air conduction is better than bone conduction, which is considered normal or indicative of sensorineural hearing loss. Nasopharyngeal tonsil starts to diminish in size at which age? Around 7 to 8 years. Remember, the nasopharyngeal tonsils what is commonly referred to as adenoids, are part of the lymphatic system, and they do play an important role in the immune defense during the early childhood. However, it will begin to involate, that is shrinking in size, as the immune system matures, typically starting at around age 7 to 8. By adolescence, adenoids are often significantly smaller or nearly absent. Severe hearing loss is associated with decibel loss in the range of around 70 to 90, right? This level of hearing significantly affects the ability to hear normal conversation, and individuals may require hearing aids or other assistive devices to improve communication. The most common fungus associated with ear infection is ear infection. We have the aspergillus. This is the most common fungus associated with ear infections, particularly the cases of otomycosis. It's often found in moist environments and can cause infections in the outer ear canal. A laryngectomy is performed primarily to drain the purulent fluid. Remember, laryngectomy is a surgical procedure where a small incision is made in the tympanic membrane to drain fluid, often purulent, from the middle ear. This is typically done to relieve pressure and alleviate pain, especially in the cases of acute otitis media with effusion. While the procedure may indirectly help with the middle ear in middle ear function, its primary purpose is to drain the fluid. It's a rare disorder of the ear characterized by progressive deafness, vertigo, tinnitus due to swelling of the membrane structures within the labyrinth. This is the Marian's disease, which is characterized by progressive deafness, spinning sensations, and ringing in the ears. It's normally caused by abnormal buildup of fluid in the inner ear, leading to swelling of the membrane structures within the labyrinth. This condition can cause episodic attacks and is typically managed with medication, dietary changes, and in some cases, surgery. The client has vertigo accompanied by tinnitus as a result of Marian's disease. The nurse should instruct the client to restrict which dietary. Marian's disease, you look at the sodium, right? Look at sodium. A low sodium diet can help reduce the frequency and severity of episodes. Additionally, reducing sodium intake may improve the overall fluid balance in the body. The cervical vertebrae C1 is also known by a specific name. What is the name? C1 is the atlas, guys. Atlas works in conjunction with the second vertebrae, which is the axis, to allow the head to rotate from side to side. After total laryngectomy, the patient has a feeding tube, and the feeding tube is effective if the tube feedings meet the fluid and nutritional needs of the client, right? What about the short answer question? Some of them included outlining 5 goals of management for a patient diagnosed with cancer of the larynx post-laryngectomy. Remember, you have to maintain a patient airway, promote effective communication, promote adequate nutritional support, prevent and manage complication. You offer counseling and emotional support to help the patient adjust to body image changes and loss of voice, pain management, rehabilitation and follow-up, and providing education on the stomach care, lifestyle modifications, and recognizing signs of complication. The other question was, with an aid of a diagram, you describe the landmarks of anatomy of the nose. Remember, you have to look at the outer nose, which has the root, the bridge, the tip, the nares, the columella, and the ala, while the inner has the nasal septum, nasal turbinates, the metaces, and the cornea, and the olfactory regions. State 5 health messages you will share with a patient diagnosed of common cold to promote recovery. Remember, you have to ensure there is adequate rest to help the body fight off infection. They have to avoid smoking or even secondhand smokers, use of over-the-counter medications wisely, practice good hygiene, eat nutritious foods, humidify the air, avoid overexertion, and seek medical advice if symptoms do worsen. 5 major causes of nose bleeding. We have trauma or injury, dry air, allergic rhinitis, infections, some of the medications like the cocaine we've used, underlying health issues, and chronic sinusitis and structural abnormalities. Describing how Rhine and Weber tests can be used. Of course, for the Rhine, you strike a tuning fork, you place it on the mastoid process, then you hear the ear canal to compare bone and air condition. While the Weber test, you would place the tuning fork on the forehead to detect lateralization of sound. With the aid of diagram, you describe the landmarks of a tympanic membrane, right? The landmarks of, you have the cone of light, we have the pars flaccida, we have the pars tensa, you have the cone of light or light reflex, you have the handle of the malleus, the incus, and so on and so forth. Describing how cerumen imperfection can be managed. You do the assessment, you soften the cerumen, you irrigate, you can do manual removal, and then you're on prevention and education. Explain the pathophysiology of tonsillitis, right? You talk about the infection of the tonsil, then you look at the immune response, activation, inflammation and swelling, local tissue damage, and talk at the systemic effects. Number next, you have been given patient X is diagnosed by autosclerosis. You give classic symptoms of autosclerosis and then pathophysiology of the disease, then explain the nursing management of the patient with autosclerosis. Of course, those were the signs. You have Master K admitted with suffering with acute otitis media, signs, draw anatomy, and then and that is what was able to be looked at. Thank you so much, guys. See you again in the next